GFAP is a biomarker which indicates potential astrogliosis and which may associate with neurodegeneration in patients with a neurodegenerative disease. And it can be measured both from the cerebrospinal fluid, CSF, or blood of these patients. And it has been in previous studies been kind of implicated as a potential biomarker, for example, in Alzheimer's disease. And also there are studies on some genetic forms of FTD. So we know that FTD is a disease that's very difficult to diagnose in the early phases, especially because the patients often show overlapping symptoms, for example, with psychiatric disease patients, and therefore the differential diagnosis is very difficult. So we took this approach and we asked whether this blood GFAP could actually be utilized as a biomarker to differentiate FTD patients from psychiatric patients. And also, so what we found that indeed it can, and so as compared to both psychiatric patients and healthy controls, we found that the blood levels of GFAP were significantly higher in FTD patients. So we think that it may have some kind of good performance as a discriminating biomarker in the early phase of this disease, when it's very difficult to kind of pinpoint whether it is actually FTD or some other disease. So we also observed that these higher GFAP levels in the blood of these patients correlated with faster progression of the disease. So we think that it may have some prognostic value too. However, our Finnish patient data set was fairly small. So of course, further studies are needed to confirm these findings. But so far we were very happy and we found these findings very promising.